very first time I heard that, which was early in my career, it kind of stopped me in my tracks. And I thought, so if I'm like 70 and I need something or
sorry,
you
Susan, we're done with you.
Yeah,
So
yeah,
we're not
exactly.
going to spend any more money on you.
Right, it's not worth
it.
Welcome to the Purr Podcast, your favorite feline-focused podcast, where we dive into all things feline, medicine, surgery, behavior, and of course, a sprinkle of veterinary gossip along the way.
I'm Dr. Jolle Kruppenstein, feline fanatic, surgery nerd, and self-proclaimed lover of all things awkwardly cat-related.
And I'm Dr. Susan Little, proud cat vet, podcast enthusiast, and your guide to the wonderfully weird world of feline medicine. Let's get started.
Hello, this is Dr. Jolle Kruppenstein.
And I'm Dr. Susan Little.
And this is the Purr Podcast. Right.
I wonder what percentage out of all the podcasts we've done, I wonder, Jolle, what do you think the percentage is of ones where it went
less
well?
than 5%.
Oh no, it's got to be more than 5%.
Less than 5%.
Yeah, I have a thing with the openings. I don't know. I'm just never ready, and then he starts without any warning, and then I don't know what to say, and
It's
I forget
always
my
the
name.
same, though. It's not that it is really unexpected. Oh, he's counting down. What should I do? No, it's
Well,
always the same.
you also count down really fast.
Uh-huh. Mm-hmm.
Can I pick on the surgeon again?
Yeah, please.
He was like that way in anesthesia too. All of a sudden, the patient jumps and the surgeon goes, starting. Like, yeah, I noticed that. I could tell.
Yeah, I could tell.
Yeah. And
Heart
again,
rate goes. Right.
my
like
horse
that.
jumps off the table. Yeah. And again, for all the surgeons listening, love working with you guys. And I'm obviously making
That's
fun of a very small percentage.
Yeah.
And I hope you're making fun of me right now.
But but hey, if we can't laugh a little bit in veterinary medicine, it's not so much fun.
No.
I love the fact that I'm pulling on the ovary. Yes, I know, because I can see it that you're doing it because you get a reaction there. But
Yeah.
anyway.
Oh, really? That's why the heart rate just went up?
Yeah. Right.
It could be.
Didn't learn that in my residency.
Right.
Well, we're really fortunate to have Dr. Tamara Grubb back with us for the second episode. And I think we promised it would be on chronic pain. Like my knee aches. So, I think it's a good topic.
I have a question before we go there, and that's a surgery question. So when you tie off a PDA, you get a response. Why is that?
Yeah. It changes the pressure. A pain response or a physiologic response.
Yeah, also in the heart rate.
Yeah,
response.
it changes the pressure.
Right.
Yeah, blood pressure.
That was right out of the blue.
I know. We have an anesthesiologist.
I know, but I'm like,
questions.
hello?
This is an exam question.
I
think
She must feel like she's taking an exam.
I'm just testing her.
Yeah, you're going to be throwing random anesthesia
No,
questions.
you might have
guinea
invited
pig.
some person that
Random
I don't know.
physiology
Exactly,
questions.
yeah. But isn't that what you like? Physiology?
Yes,
See?
of course.
See?
Yeah,
No
well,
problem here.
But see, that was a typical surgeon thing. Now we're talking about chronic pain. Oh, but by the way, what about a
That's
PDA?
true. That's true.
But
Thanks for letting me make fun of you.
Right. So this episode we're going to talk about pain. Because last episode we talked about anesthesia, and I know that a lot of people have a lot of questions still, but we're now going to focus on pain. We had some people talk about pain before.
We have often had over the years. We've had Duncan Lascelles and Mark Gruen.
Oh,
Yeah.
I'm following in huge footsteps.
But Sheila Robertson as well. Who's a big.
She's amazing.
Right?
They're all
So,
amazing.
Yeah. We do have some really amazing, engaging, like good speakers, like you and the other people that we've named. But there's still a big need, I feel, in recognizing and then appropriately treating chronic pain. Right?
Yeah.
I mean, after all, even in human medicine, I still feel that it's not fully understood, right? There's still like dark corners.
Oh, yeah.
Don't you think?
Oh, absolutely. And then in human medicine, unfortunately, there's also the hurdle that some people come in opioid seeking. And so do they have pain or do they not? And that really ties the hands sometimes of the MDs. And that's just so sad because like you said, there's already kind of a deficit of what we know. And then animals, especially cats, don't tell us in a way that we recognize. and to get the pet owners to understand it, because if the pet owners don't see a change, then we don't see the patient. So we really have to educate them, and it's probably happened to all of us at some point in our career. I still see it now and then when somebody, a cat will go home or the other species will go home, and someone in the practice will go, "Can you believe that she did not know her cat was in pain?" Like it's so obvious, everyone knows. But if a cat caregiver, I know I don't own my cat.
I still say cat owner because I can't help it.
I should say I'm owned by my cats.
There you go.
If they don't know what pain looks like, how do they know what pain looks like if they've never had a pet that they knew was in pain? Because they think they're going to vocalize, and they don't, especially cats. But that's a survival mechanism. We vocalize because we're in a social society. If I cry or vocalize my pain long enough, you'll help me. You'll recommend a doctor.
It's our social construct.
And our pets, our patients, they're from a prey predator society. So if they're out vocalizing their pain in their brain, they're not going to get help. They're going to get eaten.
I think with chronic pain too, often it kind of creeps up.
Right. And you don't notice the change.
If your cat is hit by a car, that's like, oh my gosh, my cat is injured and in pain. But
if your cat is surgerized, we tend to forget that.
Yeah, we do.
Any surgery is painful.
Yes, you're a surgeon to say that.
See?
Wow, I like you.
Yeah, exactly.
Yeah, oh my god, I respect it. Yeah,
they won't last long.
But you're right. That slow onset, it's not recognized by the pet caregiver.
Is it just old age?
They're just slowing down.
But I don't think that even is recognized by the vet very often.
I agree. We still have a lot, and having, as we've said, our different backgrounds, but early backgrounds, having come from first and still being in first line opinion practice, you are so busy all day long and you're seeing everything boom, 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 boom. So it is hard to keep up with everything. And
it is. And I think the other thing that's a barrier with cats, like if you have a member of the lesser species, they will usually walk around for you, right? Or they'll, you can usually ask them to perform something, so you at least can evaluate. But that's quite difficult with cats.
But we do have the grimace skill.
Yeah, but that's more acute, I think.
Yeah.
And so I'm a big fan of videos from owners.
I totally agree.
Yeah.
Because then we can really see what they're doing at home, and even the dogs. But you're right, the cats, it's more important because the dog's going to limp across the parking lot potentially, and the cat comes in a carrier. And it's fun to teach the students, like, well, you can see the dog walk around, but the cat really not. You can't take the cat out of the carrier and see it walk around the exam room. No, because it'll go directly under the chair.
Yeah, give it a try. Just see what happens.
The only ones that I think tend to walk around are 2-year-old male orange tabbies, and they don't have any pain.
No, and they own the world.
Exactly.
And they're happy.
Yeah.
I totally agree with you.
Right.
But I think that's one area where videos are good.
Videos are so helpful, and also getting the pet parent to understand that behavior changes. They're not just getting old. Oh, they're getting grumpy. They're old, or they're hiding under the bed. No, if there's a behavior change, there's probably often a medical problem, and often that is pain. And so I love all those checklists and things out there to get the pet parent starting to see, like, oh, yeah, my cat actually is hiding under the bed, or my dog is biting.
Sometimes it's just awareness. Sometimes it's kind of like pointing out the obvious, right? That when you're at home and it happens so slowly, it goes right by you.
Right. And so they don't even see that. Yeah. Well, when did your cat start hiding under the bed?
Yeah.
Well, I don't know. It's been a while. Because you're
right.
He
stopped going upstairs. He doesn't never goes upstairs anymore.
Yeah. My favorite is when a client will say, after 13 years, I finally taught my cat not to jump on the table.
No, right.
I'm sorry, 13-year-old cat is not going to. No, you didn't. It's like,
so tell us about your chronic pain clinic that you at last have time to set up.
Do you know what? It's definitely just a component of the whole hospital. So I'm just a little person in the cog, and the little cog in the whole big mechanism. So it's not a whole dedicated pain clinic, but I get to do pain management. So just been a really nice, refreshing options. Our associates in the practice are so busy. It's not that they're not interested. It's not that they don't want to do it, but when you are everything, the doctor of everything, you have to do. You can't do it all. So the fact that they can identify a potential patient in pain, and maybe it's a consult on the phone or they're in, and then I can go in and talk
Mhm.
about joints, talk about pain and how bad pain is. Pain causes so many negative adverse effects, and then start talking to them about what we can do for their pet and what analgesics and what physical medicine, massage, acupuncture, and just see them start to really go, oh, I can do this.
Mhm.
But it's a time consuming.
It is.
So
Okay.
it
It's one of
has,
the time-consuming things.
it is, isn't it?
But that's kind of the best of both worlds, right? Because you're working with a team who gets attuned to to being aware,
Yes.
and then they can pass it on to you, provided the owner's willing, of course.
Yeah.
But it's kind of the best of both worlds, I think.
Yeah.
Right? The owner stays within the practice, so the sort of the total animal care stays in the same place. Yet you can carve out that chronic pain and address it.
And you're right. I'm sure you see the same thing when we can help their pet that they didn't even know needed help.
Mm.
And I love those. Oh, my cat's like a kitten again, or climbing up its tree again.
Chronic dental pain is one of the ones, isn't it?
Oh my gosh.
Chronic dental pain.
Yes, I'm glad you brought that up.
Because it's again, it kind of sneaks up on the owner and the cat, right? And cats will continue eating no matter what. They won't stop eating because of dental pain, right? And so it's really hard to get owners to even open their mind. But as soon as they have the dentistry, right, and appropriate pain management, and they go home, then the owner says,
yes,
now I see the difference.
Yeah.
Now he's like more interactive, now he's more willing to play.
Right, sitting in our laps again, carrying his little toy around again, whatever. And it is amazing to me that is still the answer. He's still eating and not crying.
Right.
If those two things are happening, you're not in pain. And it's back to the survival, like we said, not showing pain is survival, eating is survival. They eat to survive, and I'm sure that we were the same back when our ancestors way back were cave people, didn't have a dentist, but whatever pain they were going to, they had to eat. Yeah. And so now we don't have to do that. We can go running and screaming to a dentist. Yes. The education, so I'm sure you're on this too. The education of dental disease is painful in a cat it's not just the cat parents either. It's our colleagues, and
it's funny. It always brings me back to ancient Egypt, where that the mummies of the royalty have these horrible teeth and these amazing abscesses. So they must have been in so much pain in the last couple of years.
Isn't that awful?
And
I think if you've ever had dental pain yourself, you can relate a bit more.
Yes, for sure. I hope no one has, but who has?
I've had dental disease like all my life, always a lot of problems, but I do think that makes a difference, right? If you ever had a toothache or ever needed a root canal.
I do think in human medicine, they often push you towards, just use an NSAID, you're fine.
Yes.
I think as vets, you're so used to multimodal anesthesia for analgesia, which I think is really the way to go.
It really is. The pain pathway is a complicated pathway, and especially once pain has changed that pain pathway, so especially in chronic pain. So without multimodal, it's really tough to completely control it. And again, it doesn't have to be all drugs. It can be some physical medicine as well.
So where did you learn acupuncture?
I did the Colorado State course.
Nice.
I think they're all good. There's different looks at it, but my mind, it's a more Western based one, was really looking at acupuncture points anatomically and stuff, and so my brain was more there. I totally believe in the Eastern approach too, and most of the points are the same anyway, but maybe there's a different reason you're using it. But my brain was like, a lot of it's like take the pulse and stuff is one of the things for the Eastern medicine. I'm like, when I take a pulse, that's the test. It's for a different. But they're whoever is trained, they're good programs, and just the ability to add that in. And I did learn though with acupuncture not to make the clients listen to me about how acupuncture works, because a little bit, yes, but not using my acupuncture words. Because when I said, when I say, how does it work? Well, it releases chi. And so I had a really cute elderly lady say, cheese? Releases cheese? Like, maybe I need to talk more about trigger points.
Yeah.
And so I do
Maybe
a
we need to
Dutch
adapt.
version, it would work really well. The cheese thing. You know?
Cheese.
Yeah.
Yeah,
Releases
I like
cheese.
that.
Oh no! Now I understand. That's it. Cheese is
Cheese.
good.
Oh,
Yeah.
cheese.
I love cheese.
Yeah, I
It's
love
all about
cheese.
the
Yeah.
cheese.
Yeah.
It's wonderful, isn't it? How pet parents teach us how to
Oh,
communicate.
gosh.
Yes.
I think I'm so smart. I'm talking about like,
Yes.
well, that didn't go
Wait a
there."
minute.
Exactly.
Wait a minute.
So let's start over.
Yeah.
And I think that's a lot of communication, always.
It
For
is.
whatever we're talking about, is meeting that client where
Where they are.
understand it. And
Yeah.
and it doesn't mean it's not talking down at
No,
all.
I think it's
is-
finding an initial like pitch.
Yes.
So I've always tried to find sort of initial pitch because you can always go up,
Yeah. for
right?
sure.
But once you've been up there for a while and you start to come down, then it sounds like you're talking down, right?
Right.
So
Yeah.
at least that's what I
I
think.
think
So-
that's a great way to do it
Mm.
because it's you're right. Just
Mm.
finding and what is their background? Do they have a
Mm.
medical background or?
And you'll often tell, right? You
Oh, yeah.
might use like a more simple word, and then in the next sentence or two, you'll hear them use a more,
Yeah.
I don't know, anatomic word. Then you're,
Yeah.
oh, okay. So
Yeah.
it's listening and adapting.
Right.
I think
We say fever, they say pyrexia. Oh, well,
Okay.
yeah. Okay, then. Right.
it's a listen
yeah.
and adapt. I think.
Yeah, absolutely.
Right.
And isn't that the goal of life? Listen and
Listen and
adapt.
adapt. Oh my
Yeah.
God.
Oh, look at that.
Look at
That's
that.
true, and I'm not
Right.
usually a philosopher.
I know.
Oh, that's just it.
Aw. I like that though. I do like that it is such a multimodal approach to chronic pain. Chronic pain is so common, whether it's people or our in-home pets, well, any pet really. And in none of these species or situations is there an easy fix.
No,
Right.
for sure.
Right.
Yeah, yeah, and like you said, even humans. I mean, it's
There is
pain is there. It's so complex, and you don't know where it's necessarily coming from. Is it still
Right.
the periphery, or now it's the spinal cord, or is it in the brain, or the descending inhibitory limbs? So that's why
It's too much.
just-
and
yeah,
the
really
pain
have to-
itself changes everything too.
Yeah, right. The behavior and the quality of life and the interaction, and it's sad because a pet in pain is not a very pleasant pet. They're
Yeah, that's true.
reactive. They're hiding under the bed. So it's bad for the pet because now they're not going to, the owner doesn't want to pick them up, doesn't want to find them under the bed.
Mm.
So that things are just getting worse and it
Yeah.
breaks that human animal bond that we so rely
Yeah.
on to get the pet the treatment to start with. And,
That's
you
true.
know, and that's bad for the pet parent too.
Right.
They love that pet. It's a family member. And so pain is not just physical. It's a lot of emotional,
Yeah,
sensory,
inevitably.
A lot of the articles lately in elderly cats say that elderly cat in more than 90% have changes of osteoarthritis
Yep.
or DJG, which go along with pain.
Yes.
So, do you still think we're under treating cats?
100% or
Mm.
200%. How many percent can I have?
Mhm.
So,
I'm
what
not
what
math-
what
not
age would you say we need to start thinking about this?
Yeah, with cats, the data shows that by 6 years of age, about 60% of cats have osteoarthritis pain, not just arthritis. And like you said, the 90% at 12 years of age, that 90% of the
I know,
cats,
it's
isn't it?
great.
It's just so
Yeah.
sad. And so
I feel like once you're over 10, you have pain until proven otherwise. Like I
Yeah.
flip it around, right?
that's a good way to do it.
But do
I like
you
that.
every cat? Do you put on painkillers?
No. You evaluate every cat,
Yeah.
right? Like you assume going in all likelihood, this cat has some chronic
What I
pain.
struggle with, I understand that, but what I struggle with the chronic pain is that they don't show it as well.
Mhm.
So how do you know?
So
Why
there's-
don't you go
there's-
for the safe way and say just put them on painkillers?
Because
Yeah.
they're cats.
Because they're cats.
And their metabolism's not the same as any
Yeah.
other species.
And because by the time they're in that high probability for especially like osteoarthritis or orthopedic pain, they probably got other things going on too, right? And so at least I don't think it's a great approach, especially to start with something like an NSAID, right? And oftentimes you have to convince the owner that the cat has pain, and that's where all these little checklists and things come in. Because in a way, I really don't care if they're validated because I'm using them as an owner awareness tool.
Right. Yeah, me too. The ones that are really good that the owners understand. But I do agree with your approach at times, not just all cats, but if I'm suspicious, I will, you're probably the same, I will ask them with analgesics if they are painful. And then when the pet parent can see the difference, we've also asked the pet parent to observe. And so
that's
it's amazing how many times.
legitimate test, isn't it?
Yeah. It's not for all of them, but if you really need to know, same thing for acute pain. If I'm not sure, I'll ask them, because that's an opioid bill. It's not something that's long term, but asking them with pain relief is actually quite mind-opening, eye-opening for me, for people learning about pain, for the owners. Yeah, it's really like, oh, that's a different. And I love when new analgesic drugs come out, like recently Silencia, and there was all this stuff like, oh, my cat got my cat back. And then some people saying, my cat's a jerk again, I don't like it. Yes, you have to like your cat.
Sorry.
But it's back to his own personality. He's jumping up to the top of the refrigerator. He's
on the counter again.
Yeah, but just to see the change and to hear people like seeing the change. So
in this, once again, we always have to talk about multimodal, because nutrition plays a role.
Absolutely,
other things
whole
that
body
you can do
health.
before.
Yeah.
Right.
So. Weight optimizing, weight.
Yes, I think that gets overlooked too, right?
Doesn't it?
Yeah. And environment. I mean, we always talk about the little box that is really high up, and you have another cat. Why do you make it so difficult for them?
Right.
And
finding other ways for them, managing pain, but also, like you said, environment, finding a way for them to get up into a window that they like to sit in versus having to jump all the way. So little ramps and things like that are so nice. And the litter box is one of my favorites. Not just the high litter box going like, oh my God, who could get into that? I'm like 5 foot, I couldn't.
If I was cat size, I couldn't get into that thing.
I couldn't.
Yeah, imagine you have to go to the restroom. You first have to climb a fence.
And then kind of plop over the other side.
Right.
Then I would start doing what many cats do, is inappropriate peeing.
It's like, okay, I'll do it.
We pee on the floor too.
Exactly.
It's just easier.
It is easier. And that's one of the litter box things when a cat parent will say, well, he's peeing outside the litter box.
He's missing the box.
Yeah, and then
like he's not missing the box.
No, it's a magical sign of pain. I mean, who knew till somebody knew that the litter box could be so diagnostic?
I know. Did you ever think we'd spend so much time talking to people about litter boxes? This was not on my bingo card for right for this point in our career, but it just shows you how you have to expand beyond what's in the exam room in front of you. Right.
Really get the picture of what is at their house and what's going on and how many little children are trying to pick them up. And there's so many things.
Environments are complicated, right? Yola says the multimodal approach is really important, and we often forget nutrition is part of that multimodal approach, right? Yeah. Whether it's part of joint disease management or, again, under-addressed, we've got an obese or overweight patient. Right. And really, we underestimate how much relief it is on the joints, I think, to lose the weight.
I completely agree. And not only the relief on the joints, but fat is an inflammatory tissue. So it just keeps that.
It's active.
Yeah, it is active.
It's active.
I do.
It's an endocrine organ.
Yes, indeed.
It's now an organ. It's true, though. And I think we still just underestimate that. And I think we don't get that message across to owners, and so they don't prioritize it. And then you still have the obese cat or canine, for that matter, right, coming in, and the drugs aren't doing as much as they should, because no drug can overcome all of it.
And same in human medicine. It's the first thing we're told if we have osteoarthritis or whatever is lose weight. And then luckily that hasn't happened to me, but I hear friends and colleagues going, it made all the difference. It just to get that weight off.
Lose weight and build the core. I mean, build your muscles, because that's the other thing that we don't think about.
Yeah, playing with kitties with the little feathers and stuff, making them move around and building them moving. And back to the high percentage of aging cats that have osteoarthritis pain. I think at least I know, have felt or been taught or just made it up all my life that, old kitties, they just sleep all the time. The older they are, the more they sleep. And we don't say that, but now that I see those numbers, I wonder how many are in pain and just don't want to move.
I was so surprised when I was in the University of Guelph, where they have a beautiful rehab center, primary care. How many cats came to the rehab center to start swimming?
Nice.
And you know and they have the little
Little
vest
vests.
on, and
Yeah.
they go around and
Yeah.
around and it's such good exercise for them.
We
But,
forget that some
right.
some cats are quite amenable to that.
Right,
Yeah.
right.
And some are absolutely not.
Sure.
Right.
They
Of
climb up you
course.
to get away.
Oh,
But
sure.
way more than we thought. And,
Yeah.
and hooray for the veterinarians that talk to the,
So
the
let's give it a
yeah,
try.
let's give it a try.
Right,
And
exactly.
the owner that said, okay,
Okay,
and the
then.
cat that went, I can do this. You know,
Yeah.
it's a great,
Yeah.
great combo, great team.
So one of the questions I always ask is latest article that you either worked on or that you read.
Uh-oh.
Oh, I thought,
Okay.
it was you were going to quiz me on something.
No,
I wrote.
no,
Oh my
no,
God,
no,
what
Yeah,
is it?
he secretly has an article and he's
Yes,
no.
yeah. Okay, page 2 it says.
Oh, nice. So many. I can't even. I have to pick a favorite.
Yeah.
Or most recently.
The
what
most recent.
kind of comes top of mind?
So actually, it was one of the topics I had this today in the lecture hall, and that is the title of it was "Too Old for Anesthesia, Never."
Oh, I like that tool for
Yes,
anesthesia.
because
Right.
if they need anesthesia, just because they're old, so then we just cater to their needs. Maybe that we're more cautious, but the bottom line is age. We've all been taught this. Age
Yeah.
is not a disease, and it's true. We're more likely
However.
to develop disease processes as we age. But we've all seen those 10-year-old kitties, one who has frailty, like the phrase that's used in human gerontology,
Yes.
that has changes from aging.
Yes.
That's the disease, not the age, because the right
Yes.
next to it is his 10-year-old
Yeah.
housemaid
Yeah.
who is perfectly healthy.
Yeah.
I'm so
I like
happy you
that.
said
I
that
like that.
because
Yeah.
I had a client not that long ago getting an advice that they didn't want to do diagnostics because of the age of the cat. So I'm like, what?
You hear that. You hear that.
yeah,
It's like
still
it's
happening.
not worth spending money on, right?
Right.
And I think the very first time I heard that, which was early in my career, it kind of stopped me in my tracks, and I thought, so if I'm like 70 and I need
Yeah, but-
something, or
Right, sorry,
you know-
Susan, we're done with you.
Yeah,
So
yeah,
we're not
exactly.
going to spend any more money on you. because
Right, it's not
you're
worth
a
it.
hopeless case. It's you might have a year or two, and
Yeah.
that's it.
yeah,
Yeah,
you get what you get.
Yeah.
You're a cat expert. What is that bringing to the world?
Yeah, I mean, really.
exactly.
Okay,
I
everything.
think you're done. You
Yeah.
know.
But it makes you wonder,
Right.
right? Like sometimes you just have to move things into a different context,
Yes.
Right.
right? And
Yeah.
and say, well, like, what if it was? Do you like your mother? What if it was your mother?
No, I totally agree. And with cancer, obviously, you get that question all the time because my cat is so old. Shall I still do it because he's so old? And I'm like, age is
It's
not
less
a reason not to do
Yeah,
it.
absolutely.
I think it's less common than it used to be, but it's not gone.
It's not gone. I agree. We're getting better at realizing that it's not the age, it's the disease. It's the disease processes that come with age, and we can manage them better. So,
And I think some vets have been a block too. I mean, some vets also have had the attitude,
Absolutely.
you know, it's not worth it to spend that on the $200 panel or the
Right.
x-rays, right?
Because we're so old, you know?
I just had a wonderful attendee in the vet discussion this morning, and she shared a case with me, and it was just perfect for the topic. She said it was a 21-year-old cat with horrible periodontal disease and also a little underlying health. Maybe it was even cardiac, but not bad, just a minor. But she said we have to fix this cat's mouth. It's incredibly painful. And the woman said, no, my other doctor said we shouldn't anesthetize it. It's just too dangerous, too old. And so the veterinarian that was there this morning, she said, so I told her, then if you're not going to do anything to fix its pain, you should put it to sleep.
Yeah.
And that's how I feel.
Yeah.
And if you're not going to do either, then I don't use a
Yeah.
client. And the next day, or maybe next week, I'm extrapolating, but the pet parent came back, the cat owner came back and said, okay, let's try. And of course, that's exactly what we think it would be. The cat's fine under anesthesia. And within one day, the cat is more playful and eating. And
You know,
I wish she had videoed it.
that I think sometimes vets fear to say it as plainly as it is, right? Because there are scenarios where the doing nothing is the worst choice.
So vets are scared to death about death.
Yes.
That's the thing. So you always think about the worst thing that can happen, and that's that you will kill the animal,
right? Or you'll tell the owner to kill the animal, right? Like you're the one saying,
Like that
You know?
veterinarian this morning was brilliant.
Yeah.
I told her that,
Yeah. I've definitely done that with some clients over the years. And I think sometimes that sort of degree of frankness is warranted, because otherwise doing nothing means that that patient goes home in the same amount of pain, right?
And in that case, doing nothing is causing harm.
It's harmful.
That whole above all else, do no harm.
Yeah,
but doing nothing when they have pain.
All right, so we have a 21-year-old cat that has minor cardiac issues, as you described. What protocol would you use for a cat like that? And for the rest of the periodontal issues?
Starting with opioid pre-med for sure, leaving out my alpha 2.
Older.
Yeah, and the cardiac disease, it's mild, and if it was the canine species and it was mild, I'd probably use it anyway, but cats have some hidden diseases that we can be concerned about. So still an opioid, and depending on how calm the cat is, maybe have a touch of a benzo. It would be a little bit of dazolam would be a good choice. And if they were really sick, maybe alfaxalone IM with a little opioid, and then IV propofol to effect. So in that cat, I would probably leave out my favorite ketamine, again, because of the cardiac issue. But I would probably, if it's really bad, I would use it as a constant rate infusion intraoperatively to help block those inhibitory receptors.
Nice CRI.
And it's such a low dose. It's almost holistic, isn't it?
You know, I used to be.
It's like acupuncture.
It works, but we're not sure how.
I'm a relatively math phobic person, and CRIs have usually put the fear of God into me. But a ketamine CRI is easy.
It is.
The math is easy.
It's really easy, and again, it's such a low dose. And
yes,
I just
love
heard recently from someone who really wants to start doing ketamine infusions in her practice. But someone said to her, well, no, we don't know how long you can run them because the ketamine is going to accumulate. Well, over a lifetime, how long are you running?
How long is your anesthesia? Exactly. Are we talking days here? Or
and they were even worried about overnight. And I said, those cats that come in that are really painful, and major surgeries where they're already painful and cause more pain, like amputations. So those, like that spinal cord is going, please give me ketamine.
Yeah.
And so running it overnight, seriously, it's still not a whole dose of ketamine.
There's still a lot of learning, I think.
Yes.
Yeah,
and,
I think so
and
too,
trust.
because people are afraid.
Yeah.
They are afraid, and it's not being negative to them at all. I think that we're talking about it. It's that to bring the awareness, because I understand where they've been. We've all been afraid of something.
Sure.
It's just getting comfortable and saying, okay, many of my colleagues are doing this, or somebody who I respect is doing this, or I tried it once and it went okay. I can do it again.
I think, vets are, and I say this all the time, are inherently a bit conservative.
Yes, we are.
Right.
Okay.
And so moving into uncharted territory, especially things like CRIs, because there's math and you have to run another line, and it just looks complicated, but you can find CRI calculators online now.
I recommend a calculator. And this is going to be a sort of personal opinion, that I think the International Veterinary Academy of Pain Management has the best CRI calculator, because I was just the president. I don't make any, I just finished my presidency. I don't make any money off of it. Just a promo.
We will need to put
we'll put a link.
Yay! Yes. Thank you.
We haven't talked about gas at all. Anything?
About gas?
Yes, gas anesthesia.
Yes, it's still the mainstay, especially. And the great thing about the inhalants, and this is why if a surgery is any more than 20 or 30 minutes, really the inhalant's the way to go. And I sevoflurane and isoflurane, I like them both. I like sevoflurane because it's a little bit faster, so I like it. But the thing what the inhalants bring to the table is that they have minimal metabolism. In fact, the one that has the most metabolism is sevoflurane, and it's 2%. So the patient, as long as it's breathing,
as long as they can breathe,
it will wake up. It doesn't have to be metabolized or cleared by the kidneys. So but for those longer procedures, and it's not accumulating, and it doesn't have to be metabolized. The downside that people need to remember about the inhalants, though, is that they are potent respiratory and cardiovascular depressants. But it's dose dependent.
You got to watch.
You got to watch, and you've got a pre-med, no gassing down.
There's the other thing. Pre-meds make that so much easier, right?
It makes anesthesia safer and easier.
Yeah.
And then and to start with anxiolytics, though, truly, like we started talking about earlier, bringing those anxiolytics in and having that calmer patient to start with. And it's lower dosages for sedation, lower dosages for induction, and the drugs.
And it's amazing how low you can run your SIVO or your ISO, right?
With good analgesia.
Yeah.
I think the analgesia part is the key.
It is the key to safe anesthesia because then, yeah, absolutely right. The gas stays lower, so we're avoiding those adverse effects. You don't get the physiologic response to pain, that stress response.
Right.
I don't think people
The up and
realize.
down.
Yeah.
Viola is our
I know,
timekeeper.
I'm always the best
It's kind
guy.
of
Yeah.
neat.
Yeah.
Yeah.
It's annoying.
Well.
Yeah.
I know.
Well.
But thank you so much. This was so much fun.
Yeah, there's
I really appreciate
there's
it.
such big topics to talk
I
about
know.
that.
It is, and I like at the end where you go, "What about gas?" I'm like,
Yes.
Yes.
Specific
what kind
kind of gas
Yes.
there?
Exactly.
Yeah,
What are you
Yeah, you
talking
started
about?
with your gas passer, so
Yeah,
that's it,
true.
you know, going back full circle here.
We're back to the gas.
Back to the gas.
So, this is the Purr Podcast, where we talk cats, laugh a lot, and learn something new every episode. Together, we bring you the latest updates, surprising cases, expert interviews, and just a touch of chaos, because nothing with cats ever goes as planned.
So whether you're a seasoned veterinary pro, a new grad, or you're just here for the cat puns, you've come to the right place.